my name is Tess, and yesterday I went to the St. Luke's University Health Network Infusion Center in Bethlehem, and this is my first time visiting the infusion centers. So I worked with infusion nurses, and they also were part of the PIC team. And what they did during the infusion center, they infuse chemotherapy to patients with cancer, and then also for Bethlehem or for St. Luke's, they have them as the PIC team, which is putting a PIC line in inpatient patients. This is definitely more an observation rather than participant care, because they're dealing with chemo drugs and we're not really familiar with them, and also they're doing sterile technique, doing PIC lines, which requires more schooling. So the course objectives that I met today was objective number 2, utilize the nursing process in providing care to family and communities. So I followed around the PIC nurse for part of the day, and they used EVP of sterilization and use of proper arm, which they used the right arm to put in PICs. And then they also use EVP of waiting for 48 hours for a blood culture to result in order to give a PIC. Because if you wait before the 48 hours and the patient comes back positive of a blood culture, they will have to take the PIC line out, so it was kind of no reason to put it in to begin with. And then also, we accurately describe action, side effects, dosage, and toxicity of selected medications. So when I was at the infusion center part of the clinical, they made sure that they were titering the medications correctly if the chemo drug needed to be titered. And then they also had a stack of flashcards that they used to make sure that they understood what the drug is for. I also met objective number 4, collaborate with other members of the healthcare team in providing care to family and communities. So we contact appropriate members of healthcare team to inform changes in patient, family, and community. So we had so for the PIC line, we had residents come up to us and tell us that we need to put the PIC line in. So we collaborated with them and stated that you had to wait the 48 hours. Like, that's part of what the infection control stated. And we also collaborated with infection control, making sure that we are going along with their guidelines. And then course objective number 5, view principles of health education and teaching, counseling of family and communities and aspects of health promotion healthcare. So in the infusion center, we educated the patients on what their chemo drugs are going to be like and the side effects that go along with it. And then also on the PIC team, we educated them the use of the PIC line and that it's more beneficial than sticking them a bunch of times. So those were the objectives that I completed during my clinical day. And then also recommendations. So the only thing that I would ask to do differently was that just allow us to get more involved with understanding the medications. I felt like at the infusion center, at least at this specific infusion center, I was just kind of sitting there and they didn't really want me to get involved at all. Like, they just kind of did their own thing and kind of made me stay back a little bit. And then also, I just felt like at this infusion center, at least in the infusion center part, they weren't really as friendly as when I was with the PIC team. The nurses on the PIC team were really more willing to educate nursing students rather than when I was at the infusion center. And then also kind of allowing us to be a part, go to see the PIC team, because I'm not really sure if we were allowed to for this clinical. But since the infusion center kind of was not willing to educate me, I went to go see with the PIC team. So I guess making that more available for the student nurses to see, either in this clinical or any clinical in general. But thank you for listening.